Hello and welcome. My name is Stacy Conder and I'm a physical therapist and the Clinical Director at Carolina Kinder Development. We wanted to share with you a series of short videos addressing commonly asked questions about what we do. One part of what we do is addressing head shape issues, which brings us to our first question. Plagiocephaly and brachycephaly are terms used to describe flattening of the head. Plagiocephaly means asymmetrical flattening. So one side of the head becomes flat, which can push forward the ear, the eye, and the forehead on that same side. Brachycephaly is where the flattening is predominantly across the back of the head, with increased width of the head noted. So rather than being long and narrow, which is typical, the head shape is more wide and flat across the back. Plagiocephaly and brachycephaly can be, and often are, seen in combination. If plagiocephaly or brachycephaly is mild, it is not more than a cosmetic concern at most. However, if it's moderate or severe, it can carry with it some risks later in life, including potential TMJ issues, jaw alignment issues, glasses not fitting properly, or safety helmets such as bike helmets or football helmets not fully protecting the head. There is now research that supports many of these correlations as well as other potential issues. There's also research that shows that babies with head shape issues can be at risk for needing more speech help in preschool. With that said, a baby with head shape issues, it does not mean that there will be any significant disability later in life. Head shape issues can be successfully resolved in a variety of ways. More on that to come later. Head shape issues are much more common now than they were 20 or 30 years ago for many reasons. One reason is because the American Academy of Pediatrics now recommends that infants be placed on their back for sleep. This has tremendously reduced the incidence of SIDS, which is extremely important. The flip side of this, however, is that infants are spending a great deal more time on their backs versus 20 or 30 years ago when they were placed to sleep on their tummies. This isn't the only reason, though, why head shape issues have increased. In the past, there weren't as many options for baby gear for babies, like seats, swings, exercisers, jumpers, rock and plays. Now there are so many more options available for babies to use, meaning that they end up spending more time getting pressure on the backs of their heads. Also, they're spending less time doing tummy time if they're spending a great deal of time in equipment. All of these reasons combined have contributed to the increase in head shape issues. Sometimes a pediatrician is the first one to notice head shape issues, but often a parent sees it first. Things that a parent might notice for head shape issues include a flat spot straight across the back of the baby's head or on one side, one ear that looks to be forward of the other ear, one eye that appears larger, or the forehead protruding on one side. If any of these things are noticed in your infant, it would be wise to have it checked out as soon as possible. The earlier a head shape issue is addressed, the more successfully and quickly it can be addressed. Oftentimes, if head shape issues are addressed in the first 1 to 3 months of life, cranial landing, also known as a helmet, can successfully be avoided. In our next video, we will be talking about the various ways that we can treat plagiocephaly. Please visit our Facebook page for more information coming soon. We hope this was helpful to you.